On to some grim news coming in from India. Just a few days ago, we told you about the rise in number of flu cases in the country, the H3N2 flu. The spike in cases has led to growing concern, triggering fears of a silent epidemic. The H3N2 influenza has now claimed the lives of 2 people in India. These are the first deaths reported caused by the virus in India. One death was reported in Haryana, the other death was reported in Karnataka. In Haryana, a 56-year-old lung cancer patient has died, according to reports. He tested positive for H3N2 in January. In Karnataka, the 82-year-old man who died was admitted to hospital on the 24th of February. As per reports, he was a diabetic and suffered from hypertension. The Union Health Minister has asked the states to be on alert and closely monitor the developments, the situation in view of the rising cases. The ministry is also tracking and keeping a close watch on morbidity and mortality due to the subtype of the seasonal influenza. From the 2nd of January to the 5th of March, 451 cases of H3N2 have been reported in the country, according to the Health Ministry. And the ministry says young children and old age persons with comorbidities are the most vulnerable groups in the context of this seasonal influenza. First things first, what is the H3N2 flu? What are the symptoms? What can you do to protect yourself? The H3N2 virus is a type of influenza virus that can cause respiratory illness in human beings. It is a subtype of the influenza A virus and has been responsible for several influenza outbreaks in the past. What are the symptoms? Fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, fatigue. In some cases, people may also experience vomiting and diarrhea. The symptoms usually last for around a week, but some people may also experience them for longer. I know this again sounds quite similar to the Wuhan virus symptoms. So how do you know that it is not the Wuhan virus? Well, it can be difficult to differentiate between COVID-19 and the flu caused by H3N2 without a test, as both illnesses share symptoms like fever, cough, body ache. What can you do to protect yourself? The H3N2 influenza is highly contagious and the precautionary measures are similar to the ones for COVID-19. It is important to wash your hands with soap and water regularly. Use an alcohol-based hand sanitizer if you are unable to wash your hands. Avoid touching your face, and that includes your eyes, nose and mouth. Keep frequently touched surfaces clean to avoid picking up the virus from them. Avoid congested areas and keep your distance from those who are ill. And remember to do your bit to protect others if you are unwell. Do not go to work if you are experiencing some symptoms. Cover your mouth when coughing or sneezing. Stay safe and keep others safe. Doctors also say it is advisable for those at risk, that is people with comorbidities, diabetes, hypertension, to take the flu vaccine every year. WION now available in your country. Download the app now. Get all the updates on the move.